This video is going to look at one of the psychological therapies for schizophrenia, and we're going to be looking at CBT, or cognitive behavioural therapy. So the type of CBT used for schizophrenia is often referred to as CBTP, which stands for Cognitive Behavioural Therapy for Psychosis. Remember, psychosis means that it's a severe mental disorder. And it all focuses around challenging the beliefs, or irrational beliefs, that schizophrenics had, including the origins of voices in their head, so voices they hear criticising them, telling them to do things. And reality testing, so putting their beliefs, their irrational thoughts, into reality and trying to test that in order to reduce the distress that a schizophrenic patient has. So, if you remember, the psychological explanation, and especially the cognitive explanation for schizophrenia, states that the symptoms that somebody has are a result of faulty thinking, irrational beliefs, and faulty interpretations of events. So, CBTP aims to help patients by establishing those links between their thoughts, their feelings, their actions, and symptoms. We're trying to get them to understand that there are rational links between these rather than the irrational beliefs that they hold. And usually CBTP takes about 5 to 20 sessions in order to start showing successful results. So when you're talking about CBT in an answer for schizophrenia, and especially the AO1 section, you're going to want to hit these little red subheadings that are coming up, because these are things that it focuses on. And the first thing it focuses on is the origins of their beliefs. So they're going to try and trace back the origins from where they first started to try and get a better idea of why these thoughts, why these irrational beliefs initially started in the first place. And as you'll remember from last year, a big part of CBT is challenging the irrational beliefs of the individual. So they'll test the validity of their beliefs. They do this in a number of ways. Often it involves arguments and vigorous discussions with the individuals about how likely it is that their beliefs are true. And they'll also challenge people's delusions. They'll start to get the patient to understand that their beliefs aren't based on reality. So they might use questions like, if the voices in your head are real, why can't other people hear them? And slowly you start to challenge that belief, and the schizophrenic individual will have to start to realise that maybe what they think isn't based in reality. CBT is also about giving the patient coping strategies. So, as well as looking for alternative explanations for their beliefs, we also give them coping strategies to help them deal with the stress that these thoughts, hallucinations, these delusions bring. Okay, and it's also about helping them think about less threatening possibilities. So rather than it's the government persecuting them and tracking all their movements, maybe it's just them being over paranoid. So we also give them coping strategies to help them cope with their hallucinations and gain control of their delusions. And coping strategies could be a range of different things. It could be breathing techniques, it could be the use of imagery, it could be the use of deep muscle relaxation to help reduce any stress. So we give them a range of coping strategies to help them control their hallucinations and their delusions. We also try and make the patient understand that other people have these experiences. And this is called normalization. It allows the individual to feel that they're not the only one going through this. And that should therefore reduce their anxiety, reduce this sense of isolation that they're the only person hearing voices. And that therefore allows them to feel less alienated, and we can start to then tackle the real issues. If you remember back to last year when we looked at the cognitive explanations for depression, we looked at the ABC, the activating, belief, consequences, and the DEF model for treating this. And this can also be applied to CBTP. So we can use ABCDEF framework to help us tackle someone's schizophrenia. So firstly, we identify the acting events. We then explore the person's belief, identify the irrational beliefs that they've got. We'll then recognise the consequences. In this case, it's most likely going to be the fact that they've developed schizophrenia as a result of their irrational beliefs. We then start to dispute those irrational beliefs through vigorous argument, through discussion with the patient. And this results in an effect. Okay, they've now got a restructured belief. Their beliefs are now far more rational. They identified before that they were having irrational beliefs, and now their beliefs are far more rational. And finally, they've developed far more positive feelings, a reduction in the symptoms of schizophrenia, or a complete removal of schizophrenia as a disorder. So we can use the ABCDEF framework to help treat someone who's got schizophrenia. Now we're going to have a look at the evaluation point for CBT. So, you always start with that general therapy issue. You should know this from last year's course. So, the fact that any therapy, including CBT, requires self-awareness and a willingness to engage. Okay, if you don't have self-awareness, if you don't have this willingness to engage, then the whole process is going to be a little bit pointless. And the key thing, especially with schizophrenics, is that anyone who's got positive symptoms, like hallucinations, like delusions, may not be fully aware in order to take part in therapy. Those who have negative symptoms, like avolition, might not have the motivation or might be reluctant to actually attend sessions in the first place. So these are always issues when it comes to getting schizophrenic patients to actually involve and engage with therapy. We've got practical issues, the fact that therapy is very time consuming. If you compare it to drugs that are literally just popping a pill, then therapy can take time and time and time. And this often results in dropouts and therefore not successful treatment. Some patients aren't suited to the vigorous argument and vigorous confrontation of CBT. And also, not all patients can open up to a therapist. They don't feel comfortable giving their feelings, talking about their private thoughts and innermost secrets to a therapist. And therefore, it's not going to be successful. Far more expensive than drugs. Drugs can be quite cheap in comparison to therapy. We're going to be paying maybe £50, £100 a session. And remember, we said it takes 5 to 20 sessions to start being successful. And also, a strength of this is there are no side effects. Unlike drugs where you get vomiting, dizziness, there are no side effects to therapy. And this is a really important paragraph to learn because no matter what psychological therapy you use, whether you look at token economies that we're going to talk about later, or family issues, then you can use this therapy issue in all of those different essays. Okay, and whatever psychological therapy comes up, you can use this paragraph. It's just a really important paragraph to get learnt. So they've got studies to support this. Jahar reviewed 34 studies in a meta-analysis and found that CBT has a small but significant effect on both positive and negative symptoms. So there are studies out there supporting the use of CBT to tackle schizophrenia. The National Institute for Healthcare Excellence, NICE as it's shortened to, have also compared CBT to standard care. And when we talk about standard care, that's usually antipsychotic medication. And what they found with CBT was that it reduced relapse rates, it reduced symptom severity, it brought about improvements in people's social functioning, so they were more able to talk to other people, more able to engage in social scenarios. However, most of the studies were done using a combination of CBT and medication. So that CBT group were also often on medication. So it's very difficult to assess the effectiveness of CBT by itself. All those positives we see might only occur if you've got the combination of medication and CBT together. So again, that reduces the validity of these findings. We mentioned that there's a lack of availability of this treatment. NICE said that only 1 out of 10 schizophrenic patients get access to CBT. And Haddock went on further to support this by saying that out of 187 randomly selected patients that he investigated, only 7% of those got offered CBT as a form of therapy. And of those that were offered it, a significant number failed to actually attend. So you can see this is a major limitation of CBT, the fact that it's not offered and it's not available to patients as maybe readily as drugs are. So one of the major methodological issues you'd have to bring up in this answer would be the fact that the meta-analysis studies that we've looked at failed to take into account study quality. For example, some studies failed to randomly allocate schizophrenic patients to CBT groups or control groups. Others fail to master treatment groups from the interviewers. So the interviewer knows who's been in a CBT group, who's been on medication, who's been in a control group, who's been in a combination of CBT and drugs. So the studies often fail to mask who's in what, and that's obviously going to impact and influence the interviewer's answers and what they record. But despite all these differences, they're all lumped together into one meta-analysis. So this is one of the methodological issues you'd have to bring up when discussing the use of CBT. And a really, really important factor and point you'd have to bring into your answer is the fact that this treatment does not cure schizophrenia. It helps patients make sense and challenge their symptoms, but although it's really, really well worth doing and challenging their symptoms is really important, this shouldn't be confused with curing schizophrenia. This is not a cure for it, okay? And the failure to cure it is a weakness of all psychological therapies. There is no psychological cure for schizophrenia. However, it does let someone make sense of their condition. It lets them challenge their irrational beliefs, which, although is well worth doing, can't be confused with actually curing schizophrenia.